Welcome back, everyone. We've had to go to our original system, which is basically a phone, because all the sophisticated system that we have failed us, such is life during these very strange times. But I'm glad to be back here again with Dr. Gail Burstein from our Department of Health, as well as Kendra from Deaf Access Services, as we give the latest report on information with regards to the response of our community to the coronavirus outbreak and COVID-19. I apologize for the technical difficulties. Once again, sometimes the best plans get laid waste by one little glitch, and that's exactly what appears to have happened. So we are back with the older system. We will not be able to put the slides on the screen, but where you can read them differently, but they will be in the background. And of course, the slides are available on my Twitter page as we speak. So please check them there. Once again, we were talking about the high wind warning. High wind warning goes into effect, really effective around 3 p.m. The warning's in effect now, but I should say the highest winds will be peaking around 3 p.m. through 8 p.m. in the Buffalo area metro region with 60-mile-per-hour wind gusts, a lot better than what was originally forecast of over 70 miles per hour. But still going to be very windy. We're expecting some tree damage, especially with the rain today. So I just want to remind everybody, please be prepared. Make sure you got your batteries and your flashlights. Do everything that's necessary in case we have a power outage. We have been in touch with NYSEG and National Grid. They have additional crews ready. Hopefully we won't need them, but we do expect some power outages at this time. So please be ready at home. I was talking about the business task force and the business impact survey when we lost our feed earlier. What we want businesses to know is you should fill out the survey that's available through the Buffalo Niagara Partnership, which is one of our partners on the task force, at www.thepartnership.org/impact survey. So if you're a business owner, please fill out that survey. It allows us and gives us the information that we need so we know how to respond to your needs at this time. So once again, it's www.thepartnership.org/impact survey. Senior services, they do need assistance with regards to people who are volunteering for home delivered meals, as well as those who may need help getting home delivered meals. You can call our senior service department at 858-8526 to help a senior in need, as well as if you would like to volunteer. The various Meals on Wheels and others need help with assistance for volunteering, and that includes Feed More Western New York, which is Meals on Wheels of Western New York, and Hearts and Hands. You can call 858-8526 if you need specific deliveries, but you can also call Hearts and Hands at 716-406-8311, or Feed More Western New York at 716-822-2002. If you'd like to volunteer for them, they do need volunteers. PPE deliveries. I talked about a Dingus Day miracle. Well, actually, we got supplies as of yesterday, so it was an Easter miracle. We did not get N95s, but we did receive from New York State hundreds of thousands of gloves and gowns and some protective goggles, which are being distributed today to hospitals based on need and request. So this will not be going to other healthcare workers, but I'm very glad to say that we received hundreds of thousands of gloves and gowns yesterday, and dozens of goggles, which will be going out to various hospitals based on the request today. So thank you to New York State for delivering those PPEs. We have a number of orders of N95s. However, like everyone else in the country, there's all kinds of logistic delays. We are hopeful that we'll be able to have some of those by the end of the week, and it's just not like a few ordered. We have some very large orders for N95s. However, we're at the mercy of the distribution chains and what's happening, because most of these are coming from China, some are coming from Europe, but we hope to have N95s in stock by the end of the week. But until then, we'll deliver what we have to our partners in the healthcare industry. Make a plan. I'll turn this over to the doctor, why it's important to have a plan.
Well, we know that we have a lot of COVID-19 in our community, and so I think we have to be prepared and make a plan in case you or somebody in your household becomes infected with COVID-19. Either you get a test or you have the typical symptoms of fever, dry cough, or shortness of breath, difficulty breathing, you need to be in isolation, and everybody in that household needs to be in quarantine. So what does that mean? That means that you cannot go out, and the person in isolation cannot leave their room. So you have to think about, how are you going to get food? How are you going to get medication? How are you going to get your laundry done? How are you going to call for help if you need to go to the hospital? So those are something that you really need to plan for now, so you have those answers, and so you're not scrambling when the time happens. So you want to make sure that you have a place in your home where the sick person can stay, a room, has a nice bed, and also that they should have access to their own toilet, bathroom. If they don't, then they have to make sure there's good disinfecting cleaner on there, because they have to clean up every time they use it before they leave. You want to know that you have a good friend or a neighbor or some type of community service, the community-based organization that you can call that to help you get food delivered to your home or get medicines delivered to your home. You should have an emergency contact list of who you can call if you need help for, whatever reason. So again, have these resources on hand. Just really do a mental survey or a survey in your little black book or in your computer to make sure that you have all the resources you need at hand when you need them, because we can't say that you won't.
Thank you, Doctor. With regards to cases, death, isolation, and recovered, we have a number of new cases. There's 1,661 total positive cases today, all labs. We didn't come up with that many. I think it was actually less than 40. However, there really was very little testing that was done over the weekend due to the Easter holiday and this morning. We originally had a drive-in testing facility planned to be open today for those who were pre-approved through the Department of Health, but because of the winds, we closed that. We didn't open it. But we have 1,661 total positive cases, all labs. Unfortunately, I have to announce, since we gave the information out yesterday, that 5 more people have died from our community, increasing the death total in Erie County to 66. This does not include individuals who've died, unfortunately, in other counties. But there are 66 people who have passed as a result of this from Erie County, and I do want to offer my deepest condolences once again to the friends and families of those who've lost a loved one. Of yesterday's hospitalization report, which is also for the day before, so this is really Saturday's report, 234 individuals were hospitalized. Of those, 117 were in ICU and 100 had an airway assist. Some positives coming from this report, which you'll see. Let's go to this first. Don't know why those are out of order, but this shows that we have seen a slight increase with regards to hospitalization, but we've seen a flattening and actually a slight decrease with regards to ICU and ICU airway assist, which is generally intubation. It is down with regards to intubation, airway assist. It was about 95% for a number of days there. It's down to about 85%, and ICU number has flattened. Doctor, would we have any idea other than just could potentially be the circumstance of the day?
Right. I mean, we'll have to see if those trends persist. I mean, we hope that we will. Again, we don't know where we are on our epi curve. Hopefully we stay flattened, although we won't know when we're going down until we see our numbers going down.
Okay. And once again, going back to this one, the COVID-19 cases, age, range, and genders. Just because you're younger doesn't mean you can't catch it. As you can see, there's been a substantial amount of cases that are confirmed positive COVID-19 cases in individuals between the ages of 20 to 50. There's not a huge gradient difference between the ages, though you are much more at risk for severe illness or death the older you get. But this just once again proves that you can be any age and unfortunately catch it. The youngest we have is in the age range of 5 to 9, both a male and female. So this goes to show that anyone can catch the coronavirus, and it certainly, if you, depending on your age or any comorbidity issues you have, can have a tremendous impact on your health, including, as we've seen, unfortunately, 66 people have died in our community. And then the deaths, this is the most recent report based on gender and race. We do see a greater proportion of African Americans that have perished as a result of COVID-19 in our community than is the average population of African Americans in Erie County. It is something we are concerned about, and we're working with our partners to try to alleviate. But the message that needs to go out to the community is that everyone's at risk, but if you have underlying health issues, you are much more at risk for severe illness or death. So we are working with our partners, including having had discussions with a number of the faith-based communities and the Greater Buffalo equity community, health disparities community, about these issues. And we are working with our partners, including in the healthcare industry, especially the hospitals, to address that. But we did want to note that of the 66 deaths, we have at least 2 that are Hispanic, but of that Hispanic population is actually probably lower than the population of Hispanic and Latinos in Erie County, but we are noticing that 20 individuals of Black or African American race have perished as a result of this. And when you look at that compared to the actual percentage of African Americans in Erie County, that is actually higher than the general population of African Americans. So it is something that we are concerned about and working with our partners to try to alleviate. Mapping. Maps continue to be utilized both by Erie County and New York State. The little county map you see on the screens from earlier today, it doesn't include the most recent cases, and the state the same. But there are thousands of people who've tested positive in New York State, over 1,661, I believe it is right now, in Erie County. So you can check out our map at erie.gov/COVID map for the latest, including active cases and recovered. We are very glad that people have recovered, but it will give you a listing of active cases. And you can also see by zip code. The number 1 zip code is now 14221, which is Williamsville, Amherst, even a little part of Clarence. So the zip code is not an apples-to-apples comparison, but it does give you an idea where the outbreak is. Number 2, last I saw, was 14215. We'll look at that in a second, but that is something to consider. The COVID-19 call center, once again, we know that lots of calls come in right around the time we do the press event and press media avail on Facebook as people see the numbers. It is open till 8 o'clock at night, opens at 8 o'clock in the morning. If you call now, you're going to get a high call volume. You potentially expect to wait, but if you called in an hour or so, I'm fairly confident it'll be a little less. But just if you have questions with regards to health related, you can call the hotline at 858-2929. Do not ask hypothetical questions, and then there's lots of resources online that we've talked about beforehand. If you call the hotline 858-2929 and you press option 2, you can also talk to, you can get information on testing for those who qualify for testing that are symptomatic based on the protocol that we announced a few days ago. If you have other questions, you should always call your doctor with regards to the health. If you have no doctor, you can call our hotline and we'll try to put you in touch with a physician as well. There are a number of physicians in this area that are taking new patients. So if you don't have a doctor, now's the time potentially to think about getting a new doctor. Important resources, once again, on the COVID-19 page at erie.gov/COVID-19. And I want to wish everyone a happy Dingus Day. Before we go ahead and start opening questions, this would be a day that we generally enjoy, but not today. So once again, happy Dingus Day. And with that, I'll open it up to some questions before we move on for the day. So thank you all, media, for hanging in there with our technical difficulties. We appreciate that. I'm sorry for that. We're working on those as we speak, but we're glad we're still be able to present the information. So with that, I'll do the roll call once again. AP, anybody from the Associated Press?
So we are actually going to flip over to 3.
And if you're not on, can you please mute your phone? B News.
Hey, Mark. Ethan Powers from the B News.
Hi, Ethan. Good.
Good. I just want to ask you really briefly about the Unicast data that tracks the mobility of county residents. We've seen several downgrades over the past few weeks, and right now, overall, we're at a C- with some statistics that's well below the national baseline. So firstly, Mark, does the county pay attention to this kind of data? Do you think that the data is perhaps indicative of county residents not heeding social distancing guidelines?
Well, we have paid attention to it. We're disappointed when we see that people are doing a lot of traveling. I can't speak to the particulars because it's based on countywide. It doesn't tell us if it's particular areas that are doing a better job than others in Erie County. Erie County is a fairly large county geographic-wise, size of the state of Rhode Island. But when you look at it from a standpoint of are people staying at home, we saw good evidence this weekend that there wasn't as much travel going on. But I don't know of every part of the county. I've been in other parts, and I've been dismayed at times when I've seen traffic on the roads and people out and about, and I'm not exactly certain why they're out there unless they have particular needs. But it can be disconcerting because this is how the COVID-19 has been spread across the entire community, is through people traveling. And at this point, we're hopeful that people heed the messages like most have and just stay at home. Next is Buffalo Business First. Anybody on? If not, the Buffalo News, Aaron Bessiker.
Hi. I was wondering if you guys had any thoughts on comments earlier today. The governor was asked about whether Buffalo should be considered a hotspot.
I didn't see or hear the governor's comments. I've been in lots of conferences, meetings, conference calls mostly, and phone calls all day as we've been trying to deal with some of the response issues. I don't know what the governor said. I think compared to where we are, compared to the rest of Western New York, we're a hot spot. I don't know if you would say compared to New York City, when they're having tens of thousands of cases and they've had thousands of deaths. It's a tough comparison. We know that we're dealing with a COVID-19 outbreak here. I don't know if you can do an apples-to-apples comparison between Buffalo and downstate, or Erie County and downstate, just like you can't do an apples-to-apples comparison on zip codes. Doctor, you have any other ideas?
Well, we know that our numbers testing positive continue to increase. We know that we're seeing just so overall in terms of hospitalizations, some small increases. Again, it's hard to say that where we are in the curve until we start to see numbers coming down. So we'll we're keeping an eye on that, and we're working with our partners and taking it day by day and responding to what the data show us.
Okay. Investigative Post, anybody on from IP? Spectrum News.
Hi, Mark. Just a little bit of a follow-up on that. The governor has been saying over the weekend and today that you can say the worst is over. Do you agree with this, since Erie County does have the highest amount of cases outside of any county other than downstate and Hudson Valley?
I don't know what the governor was referring to, so I can't say. I don't know if he was talking about in general. I don't know if he was talking about just downstate. I can't say, other than we are still seeing cases.
So if you hear that in the background, you're not going to hear me.
Folks, can you please mute your phones if you're not on? It just makes it easier. Otherwise, we have to mute you between every time we open it. So once again, I don't know exactly what the governor was referring to when he said the worst is over. He may have been talking about, in general, New York State total numbers, and that may be accurate considering there's been so many huge numbers coming from downstate. We are seeing continual slight increases in our hospitalization. We have seen some flattening of the ICU and ICU airway assist curve, but we do know that when we look at a comparison in the last 3 or 4 days, on average, more people have been admitted to the hospital than those who have been discharged. When you take a look at straight admissions and those who were in the hospital and then they determined they had COVID-19 while they were in the hospital. So we see those data. That data, it's broken down by the hospitals. We get a lot of that data, then we have to aggregate it, but that I don't see something that proves that the worst is over with at this point in our region. I'm hopeful for our friends downstate the worst is over with because they had it really bad. WBEN, Mike Baggerman.
Hey, Mark, should we expect numbers to spike in the coming days, given that you mentioned there was limited testing that was done over the holiday weekend, and I assume you're now running back at full operation?
Yes, we certainly, there weren't our operation was not up this weekend. It was not up today, but our operation will be back up tomorrow. The hospitals have been still in operation, but some of the other things haven't. Doctor, would you like to add a little more?
There has been a little lull in the number of people tested over the weekend, and we do expect to see those numbers ramp up. But again, the people that are tested, it's really a select portion of the community, and so we still have to assume that there is a lot of COVID-19 in our community, and we have to assume that if we don't keep going with our social distancing or physical distancing and wearing facial covers and staying away from ill people, then our numbers will ramp up even more. So what we do today is going to affect where we are in the curve in a week or two.
WBFO, anybody on from WBFO? WBLK? WGRZ, I think we have Emily Watkins and Ron Plants.
Yes. Hi, Mark. How are you doing?
Good to hear you, Ron.
Can you
Haven't
hear
talked to you in a long time.
Yes. All right. First off, we had a few technical issues. Can I ask you to begin with, did you get the so-called Dingus Day surprise of more PPE? That's question number one. And number two, a follow-up to the question about the governor saying that New York is fine, the way he phrased it. Are you at all concerned about whether or not you're getting adequate supplies, resources, things of that nature? Do you think Western New York and Buffalo are fine when it comes to resources? Because maybe that's what he said. He said they're monitoring the situation.
Well, we could always use more resources and 95s. There's no doubt about that. The hospitals have a supply that'll get them through a shorter period of time. If you can see on the screen, the Dingus Day surprise actually came on Easter, in which our staff at our location that received these got hundreds of thousands of gowns, gloves, as well as goggles. Not hundreds of thousands of goggles, but hundreds of thousands of gowns and gloves, and some boxes of goggles, which are being distributed out to hospitals today. We are expecting shipments of N95s later this week that we've had on order from a couple sources, but our logistical chain, like many others, is much different than it normally would be, but we have a couple key big orders coming in. So we did not get any further deliveries today, but we did get deliveries yesterday, which was actually a day ahead of time. So I was very appreciative of that. And the pictures you see on the screen are just a couple of you can see there was one full trailer of what was gowns, and then we also had another trailer of gloves, and then we had some goggles as well. We have gotten supplies from various sources, including New York State, and the supplies we got yesterday were from New York State. So once again, I want to thank New York State, starting with the governor and his staff, including Lieutenant Governor Hochul, who's been adamantly out there fighting for us. And I thank them for their continued provision of additional assistance, because it is tough out there. They haven't forgotten us. I know a lot of people want to say that, but that's not the case. His staff's been in touch with us. I've been in touch with the governor myself. We don't always talk, but we text. So he gets an idea of what's going on here. And I just want to thank them for being able to provide these supplies to us at our time of need. Channel 4, anybody from Channel 4? WKBW, Channel 7, anybody from there? Are there any others on the call? We'll go back then. Anybody else have any questions, starting with B News? Buffalo News, Aaron? Any more questions?
Sorry, a technical problem here. I just wanted to ask, where do things stand with the convention center and those plans for that excess hospital beds?
We are waiting for the approval from New York State to commence that process. They've been provided all the information. They're watching the hospitalization rates like we are. They provide the reports to us. New York State Department of Health provides the reports to us on hospitalizations. So at this point, we have not been given a go-ahead to open up the convention center. We are handling that like anything else. We can't do that unless we get approval from the state. So we are moving ahead, and I should say we're just waiting on that. We are moving ahead on one other item that we've been dealing with. We opened up a homeless shelter in conjunction with the City of Buffalo, and I want to thank the Mayor and his team for helping us out by paying for costs associated with this through their CDBG funds. But we're going to have to open up another homeless shelter due to the number of homeless that have sought refuge at the shelter at SUNY Erie. We actually had approximately 40 individuals who were released from the holding center, jail, and the state facilities, and they immediately sought shelter. And so we're going to have to open up another center today, and we're working on that. But while we're dealing with the issue with the homeless, and we can do that internally, we can't do the convention center expand until we've gotten approval from the state to do it, because we need to get them to authorize the equipment and authorize FEMA and the Army Corps of Engineers to move ahead and build it. So we can't do it on our own until the state does it.
Can I ask you a follow-up on that? What exactly are they waiting for? Do you know what the conditions are, what the circumstances are that they're looking at? What are the factors that are, weighing on whether or not that decision happens sooner or later?
They're looking at the number of beds that are available in our current hospitals. We have approximately, I think, a little over 200 ICU beds that are available that I saw from the most recent report, but there are over 1,300 actual hospital beds in Erie County that are available. So it's not like our hospitals are jammed with patients. I mean, they're high because they increase the number of bed capacity at the hospitals, but they have over 1,300 current beds available in county hospitals and over 200 ICU beds. They, like us, are watching those hospitalization reports, and if they saw the number of beds dramatically decrease because of current usage, I think we'd be in a different situation talking about opening up the convention center. I am worried that if we get a big peak and it just hits all at once, it is an issue, but we are in contact with the state. They see the hospitalization report. We see it as well. It's updated daily. So if there was a spike upwards, I know we'd be having much more conversation with regards to then getting that convention center online as soon as possible.
What's the turnaround time? If how quickly could something like that be put into effect?
Depends on the size. I've heard we could have something open within 3 days, and then others it would be 2 to 3 weeks if we were seeking 1,000 beds all at once. So it really depends on the size.
Thank you. Thank you.
You're welcome. Channel 2, I think you're the only one still on. Any other questions?
Yeah, Mark. Again, I'm sorry, is somebody else on the line?
I think it's somebody else from Channel 2. So, Rob.
Okay, Emily, why don't you go ahead? Go ahead.
I'm sorry. I was just going to ask a follow-up to, you spoke about the race data for COVID-19 deaths and the proportion of Black or African-American people dying from this. Is there any specific efforts the county is making towards reaching out to communities of color and providing additional resources in healthcare?
Well, we have been in discussions with a number of parties, including various healthcare organizations, including ones that are in the community. There are some proposals out there. They are generally based off of a tremendous amount of increased testing, but right now there's no one that has the capability of delivering that increased testing. So that's why we continue to try to spread the message that the best way to protect yourself from the coronavirus is to stay home, to stop the spread, to avoid catching it. Doctor, would you like to go on further?
Yeah, thank you. So remember, there is no treatment available now, and there's no either to treat people after they've been infected or to provide prophylaxis to hopefully protect them if they've been exposed to prevent them from getting an illness. So there is no treatment available now. There is no vaccine. So remember, with having increased testing, we'll really not be able to if someone is not an essential employee, there's really not that much we can do with that information. So that's why we really need people in the community. If you're living with people that are elderly or have people in your life that are seniors or have chronic health conditions, really help them, figure out a way where they can go out, they can get their food delivered, they can get their medicine delivered, that they're being monitored to make sure that they're feeling well, and if they're not feeling well, then make sure that they can get out to, call a healthcare provider, have a discussion about their health, and see what needs to be done, and see if maybe they need to go in to get evaluated. Remember, there's no medication out there, so what we have to do is make sure that people can comply with our non-pharmaceutical interventions, make sure that people are safe indoors and get what they need to do, and make sure somebody's watching them, that they're okay, that they're not getting ill. And we need everybody to do that in every community, and especially the community that has our most vulnerable, our people with our elderly and people with chronic conditions.
Are there any? Okay, Ron, did you have another question? If not, are there any other questions on the line?
Yeah, one more
Mark
question.
from WBEN here.
Michael, why don't you go first, and then.
What sort of representation is Erie County going to have? The governor, shortly before you started your press conference today, he said that there's going to be a task force with public health officials and economic experts to reopen parts, and frankly, the entire state. What sort of representation will Erie County have on all this?
I can't answer that question. I don't know. Until the governor announced the task force, they had not provided us prior information on what the task force was going to comprise. And that's
They haven't had any contact with you yet?
Well, he went on live about the same time that I came downstairs to do this. That's pretty standard for the state. They'll often announce these things and then identify the task force members afterwards. There was one other question?
Yeah, this is
Yeah,
Erin.
Ashley Rowe here from Channel 7 WKBW. Sorry, there might be somebody else asking a question. Is it okay if I go?
Who else was on too? Just who was in it? Was that Emily that wanted to ask a question?
Erin from Spectrum.
Oh, Aaron. Aaron, why don't you go first, and then we'll go to Channel 7 because I know you were trying to get in earlier.
Yeah. So earlier today, during the state's press briefing, the SUNY Empire president said that Buffalo is considered stable, or Erie County specifically is considered stable. Do you think that if we had access to more tests, we would still be considered stable?
It's a hypothetical. I can't really answer that question. I don't know. I really don't know. Channel 7?
Hi, Ashley Rowe here. Mark and Dr. Bernstein, thank you for your comprehensive daily update. Just a question about nursing homes. There have been a number of breakouts at nursing homes across Erie County. Of course, they've been closed to visitors for some time now. So wondering, perhaps Dr. Bernstein, you can answer this question. Since there are no visitors allowed at the nursing homes, what's the presumed cause of community spread? Could it perhaps be asymptomatic employees that are going into work every day?
Well, remember that we know that many people with COVID-19 do not have any symptoms. They don't have a fever, or they have very mild symptoms. So it may be difficult to predict who's infected and who isn't. So that's why it's important that we wear our personal protective equipment when we're going out, our facial covers, and so we assume that there can be two sources in nursing homes: one of healthcare workers that have COVID-19 and they don't have any symptoms, and the second is if a person who's residing in the nursing home has had to go to the hospital and then they returned, they may have been infected with COVID-19. So those are two potential sources. Again, the county does not regulate the nursing homes. The state regulates the nursing homes, and we've been in constant communication with them about their nursing home outbreaks. And we know that the state is consulting with those nursing homes and trying to ensure that they keep their residents and their staff healthy and safe.
Actually, earlier today, I had a conversation with a nursing home operator in regards to cases at that home. I believe it's important to understand that a number of the nursing homes are receiving individuals who've tested positive for COVID-19. They may have gone to the hospital first, but they were well enough to be removed from the hospital, but may not be well enough to go home because of its particular issues. So we are in constant contact with representatives of nursing homes, while New York State is the one that regulates them. We are aware of cases, and we are talking to those representatives, including myself, talking to the one operator today to ensure that not only are the residents being properly cared for, but that we are providing tests, if necessary, to staff members who may be showing symptoms. We don't have the ability to test every staff member at every nursing home, including those that are asymptomatic. But if you are an employee that works for a nursing home, just like if you're an employee that worked at a hospital or a doctor's office, a healthcare worker, and you are showing symptoms of COVID-19, we have the ability to test you to confirm whether or not you have it. So we want people to understand that we're working with nursing homes to try to stem whatever tide there may be from an increase of COVID-19 cases in their facility.
Thank you very much.
You're welcome. With that, we will call it a day with regards to this Dingus Day edition of the COVID-19 presser. We've tried to have a little fun every now and then, at least I've had, maybe not necessarily with these presentations, but I've done some songs every now and then, and I want to finish off with a song from one of Buffalo's best bands, Focus, which has been at a couple of my events before, as we finish off this polka edition of Dingus Day. I'm going to do something that's going to get me in a lot of trouble, I know that. Normally at this time I'm at the Polish Falcons, and I always have a shot of Krupnik.
Sure, thanks.
Doc's
I've never had Krupnik.
But she shouldn't have to worry. All it does is grow hair on your chest.
I said, I'm glad I'm not topless today.
I'm only going to give her a little. So, to all my friends, and be healthy. Na zdrowie.
L'chaim.
That's tasty. Goodbye, everyone. Be well.